Suicide is not a problem that's restricted just one community or one sector of our country.
It's really everybody's business because suicide takes such a toll on our country, on families, workplaces, communities.
No one sector is going to do this by themselves, no one organization. It's going to take all of us, and it's really quite amazing when you think about it.
The Action Alliance is a fairly unique combination of public and private individuals who are joined by a strong commitment to help our nation address its suicide problem.
It brings everybody who cares about suicide prevention into one place, one opportunity to harmonize, to strategize together so that we really can reduce the number of suicides in this country.
We've set a goal to reduce the rate in the U.S. 20% by 2025.
The National Strategy for Suicide Prevention is a document that was created over the past several years that presents the best thinking about what our priorities should be to prevent suicide in this country. And it is the job of the Action Alliance to align those resources around those priorities so that we can have the most impact in this country in reducing suicide.
Someone handed me the National Strategy for Suicide Prevention that the Action Alliance had put together. And you would not think that that would be a comforting document to a grieving mother. I read it with tears coursing down my face because it encouraged me to know that somebody cared enough about people like my son to do something about it.
There's several reasons why it's important to make suicide prevention a core responsibility of healthcare. Most people who are dying by suicide have been in healthcare, have seen a healthcare practitioner recently, but we didn't work with them to keep them safe. The Action Alliance approved development of this approach we now call Zero Suicide just 5 years ago.
The Zero Suicide Initiative is a tool to reduce suicide. We've been able to use that in our facilities, and it's made a real difference.
One thing I'm really excited about with the Alliance is that it's made transforming communities a priority. And that's so important to achieving the goal of reducing the rate 20%, because in reality too, communities need to be engaged in suicide prevention. If it's not happening where people live in communities, we're not going to be successful in the goal.
Being connected to some kind of community is a major protective factor in suicide prevention. There are ways that we can break the silence in our own communities that signal to people this is a safe place in which to talk about those kinds of things.
Community-based suicide prevention is an important priority because suicide is a community problem. All sections of the community have a role to play in suicide prevention.
It's pretty clear why changing the conversation is a priority for the Action Alliance.
If we're serious about a goal of reducing rates by 20% by 2025, we need to find ways to more consistently message around hope, around recovery, around resilience.
I think we are at an inflection point in this country with suicide prevention. The Action Alliance has caused us to get close to that inflection point and really is the vehicle to push us over it and onto progress.
I want to get to the place where no matter what door a person who struggles walks through, they're going to walk through and engage with someone who understands that, we're here for you.
Our partnership is saving lives, and we're doing that together.